Welcome to the Wellness Law Podcast, where wellness and the law meet for contemplation and collaboration. This podcast is brought to you by the Center for Health and Wellness Law. I am your host, Barbara Zabawa. Welcome, Margaret Moore, or Coach Meg, to the Wellness Law Podcast. Everyone, please meet Margaret Moore, who is the CEO of Wellcoaches. She's also a health coach and very active in advocating for health coach rights at the federal and probably state levels. We'll find out. I certainly know she's at front and center with the advocating for reimbursement, Medicare reimbursement for health coaching services. And so that is going to be the primary focus of our discussion today. Welcome, Coach Meg.
Thank you, Barbara. It's just a treat to be with you.
Oh, I'm just so thrilled. You are just so well known in the wellness community and the health coaching community in particular. And I'm just so honored that you agreed to be on this podcast to talk about your constant, persistent efforts to get reimbursement for health and wellness coaching. And so I'm hoping you can provide us a little bit of history and where we are today in those efforts.
Thank you, Barbara, and equally gratitude to you for being a lawyer that is bringing the voice of a lawyer to the health and well-being space and coaching space. It means a lot to have someone like you in our community, knowing there's a lawyer amongst us. And so thank you for all that you've been doing, because you've also been very active.
Oh, thank you. Thank you.
All of us. Yeah. And this is, for me, the way I think about this is getting the professional coach in healthcare and well-being onto high ground, or higher ground at least. And I have a big commitment to this, because when I started Coaches in 2000, and I knew I was asking professionals to trust that there would be a profession for them to be part of in order to come to Wellcoaches. It's not that there wasn't a profession back then, and we still are not quite there. And as a profession, it does take decades. It's not overnight. And so I have always felt very committed to getting this gang of coaches up to solid ground. And that's meant first building a school, building protocols, putting science into coaching, writing the first textbook, building the first team of faculty, and then gathering the industry together in 2009, 2010. That led to what's now the National Board of Health and Wellness Coaching. I stepped up to advocate for our band of founders to partner with the National Board of Medical Examiners. People were not all enthusiastic about that, but turned out to be a fabulous move, because they invested significant millions, and we built an exam, and now we have 12,000 National Board Certified Coaches. And once we had that up and running in 2018, and we had a new board, I shifted gears to start what we called the Healthcare Commission, and to begin to use the platform. Now we had a standard, now we had a credential, now we could do what other professions have done, which is to, even though there isn't really a path to state licensing, and not likely anytime soon, but we could then advocate for reimbursement, having a professional body. And so that started in 2019, and now we're at a critical moment. Like 6 years later, we're at the pivotal moment where the sun will shine or will go away. It will either come up or go down. I don't think it's going to come down, but this new government, whether you love them or hate them, is devoted to using lifestyle and well-being to treat chronic disease, and that has not happened. We went to see CMS in Baltimore back in the days when you traveled. Baltimore. We went twice with our lawyers, and I was advised in our presentations to not mention lifestyle.
Oh, really?
No, do not mention it. It's not accepted. You can say health behavior. So we just talked about health behavior change, which would include colonoscopies and vaccines and taking your meds. The health behaviors was acceptable, and there were health behavior codes too, but lifestyle wasn't. And so now it is, because the new government wants it to be. So we are now at a point where we have, instead of going against the current, we've got a small current, not so rushing.
Yeah.
The current's turned, and now we got to shape the positioning of the coach, which is what I've been doing this year with all my collaborators. So it's been a long road, but this is not a new road. This is a road we've been on for a very long time. And I think that the winds, they're a breeze in our direction. And I think they could pick up based on CMS putting out a request for information, including 12 questions on coaching and motivational interviewing, which suggests they're thinking hard about doing something.
Yeah. Yeah. I'm hoping you can talk a little bit about that request for information. When this podcast airs, that deadline to respond might have passed.
It's September 12th.
Yes, it's a week from Friday when we're recording this, but you are you're intending to submit.
We have a submission, and we've actually shared it with the Wellcoaches community. It's public, so if you want to share it with your audience, that's fine.
Oh, great. Can you summarize some of the questions that CMS is asking? This was in the physician fee schedule request I think it came out in July of this year.
Yeah, July 14th.
And so this is a huge document. So for those of you
3,000 pages.
But buried within this 3,000 page document that's issued every year, they put out a physician fee schedule to adjust fees to pay to physicians. But there's all this other stuff that's buried within this huge document. And this year, unlike other years, there was buried within this document a request for information about motivational interviewing and whether and how it should be reimbursed. And so you said there's 12 questions centered.
Yeah, there's a section, the request for information bundles motivational interviewing and coaching and asks, what is the state of play for motivational interviewing? What is it? How does it fit? It sounds as though they were thinking about creating billing codes for motivational interviewing, but can coaches deliver motivational interviewing? And
Yes.
what's coaches doing? So they bundled together, they've connected together the topic of motivational interviewing and health coaching, which wasn't, we weren't expecting that, but buried in there was a mention that there are paths for coaches to become clinical staff and for there to be coding mechanisms or reimbursement mechanisms. And so back when, at the beginning of the year with the new government and then the Make America Healthy Again policy came along and said that they wanted options for lifestyle management and wellness in insurance reimbursement. And also then Mehmet Oz got appointed, and his vision was to move from sick care to wellness care and prevention. And then CMS came out with the priority of empowering patients to have health goals. So we have all these threads. So when Mehmet Oz, there were a bunch of us, MHWC, the VA, others, we were all getting ready to send something to Mehmet Oz his first week. And so the big thing that, I don't know why I didn't think of this sooner, but it came to me that the most likely way we could get the health and well-being coaching CPT codes into practice would be to give them a framework, because they're hanging out there by themselves. And then you could tell that the policymakers are concerned. They'll be used for anything. They'll be overused. There won't be any accountability. We don't know what this is going to cost. We don't know how we're going to track outcomes. This feels too loose. As we didn't have, the codes weren't built with any target population involved. They're very general. And they didn't call for being part of the healthcare team. There's a bit too general. So I realized that maybe the way to make this work would be to integrate them into the family of chronic care management codes, which are a set of codes that are 10 years old and extremely underutilized. And in good part because nobody's trained to meet with patients monthly and help them move from point A to B. It's not the natural way of healthcare. Healthcare is responsive to people's needs in the moment with an annual check-in, but there's nobody that works with people over time. Maybe physical therapists, a little bit for dietitians, but it's just not part of the way healthcare is delivered. So the coach is really ideal for chronic care management because it's a year-long program and it's up to an hour a month. There's time. There's the intention of improving health through better management of chronic diseases. So we said, embed them within that, have coaches deliver the clinical staff for codes, which is 9940 499 and 490, I think it is. And 439, sorry. 490 and 439. And there, you can't do a full coaching intervention because there's a lot of other stuff that has to be part of it. In this long checklists around symptoms and ER visits and taking your meds and all that kind of stuff, which constrains the amount of time for coaching quite a lot. But that's still, coaches do a good job with that. And we had data when we went to the AMA, we collected data from 70 organizations on billing, and chronic care management codes were being used by coaches. So we knew that it was being done, but if we added the coaching codes into the mix, we then have the full intervention, including a planning session to create goals and a plan every year. So we said, why not bring them as G codes into the Medicare program, which would upgrade, it would really strengthen this chronic care management program. And it would provide a place for people who want more intensive help for lifestyle change with the coaching code. So that's what we put forward. And then MBHWC did their own version of that. And then the VA joined us all. So we had this, we're pretty sure that the request for information had responded to those submissions and was now looking for broader industry input. So we helped shape the conversation to start.
So you sent that prior to the request
In
for
April. Yeah, April. Yeah. 3 months earlier.
Oh, okay.
So we were wondering what they would do with that. There's every reason to believe that those questions in part were stimulated by what we had proposed.
Yeah. Kudos to you for getting the ball rolling on that. Do you think that the ultimate intent of these having codes assigned to motivational interviewing and coaching for chronic conditions would be used within the clinic setting? So,
but under supervision of the providers and built by the practice, because separate, distinct from therapy, which is really an intervention that is not generally about managing your blood pressure and your weight and your A1C and your lipids. It's more about your mental well-being. And so it can be delivered without a lot of coordination of care. When you're addressing lifestyle change, you're going to change the need for medications. The American College of Lifestyle Medicine talks about it. It can lead to deprescribing. And so if you're not delivering coaching like arm in arm with the physician and pharmacist, even though we're not prescribing or recommending what patients are engaging in, will change their medication needs. And so the coach and most of the evidence is in metabolic disease. And that's where the return on investment is clear, because we know we can move the numbers, which moves the long-term consequences and even can prevent severe events in the short term too. So basically, I've always advocated for the coach on the healthcare team, not sitting outside.
Yeah.
And I think we belong on the team. I think we are key players on the team. We build deep bonds with patients around what's really going on in their lives. We really, as coaches, deal with the messiness of people's lives.
Yeah.
Turn that chaos into really positive, uplifting, energizing change. And so I think we provide an upgrade to physician practices and make everybody's work with patients more satisfying and more productive and more rewarding. So that way, by putting coaching within chronic care management, not that they'll do that, but that's what we suggested, because we wanted to have a really good home for it where we really could make a difference as coaches. And then the framework's already there. The reimbursement valuation's already there. It's already out there, even if it's underused. And so they're not starting from scratch, which is also.
Yeah, it was smart to partner with the medical community when you were proposing this, because it makes sense now that this would be part of more of a more holistic approach to chronic disease management. So I think there's a lot of misunderstanding in the coaching community, at least from my perspective. When I talk to coaches who contact me, they've heard about these codes, these billing codes, and I've had many conversations with coaches who assumed that because these billing codes existed, that now all of a sudden, as independent coaches hanging out their own shingle, could bill insurance. And I've had to try to explain that's not the case. And now it's even more clear with your work, that's not even the intent. It's
We never advocated for that. I know that coaches have gotten that impression, but it didn't come from MBHWC. Certainly didn't come from Well Coaches. I think there are some players out there putting it out there, and it's not reasonable. First, there's no example of a non-licensed professional billing insurance
yeah.
directly, really.
Yeah.
The patient consultants are on the edge. That's an interesting group, but and that's a special group. But for the most part, there's limits to how much we can change the world. But I think the main reason is that coaches should not be out there on their own in the context of patients who need their medical care to work to collaborate with
Yes.
coaching goals. We're not prescribing. The goals that patients set come from the recommendations from their providers. They come from the guidelines. They're not our recommendations. So what we're really saying, Barbara, is that, and this is what we were up against with the American Medical Association, because not everybody sees it this way, and we're getting closer, but coaching, which is to help people design and implement their own health, lifestyle, and well-being goals, which serves two purposes. It serves the healthcare purpose, which is to improve their health numbers and whatever gets measured there. But their purpose is to improve their well-being. And if they don't have a purpose related to their well-being, then they're not going to be motivated. They're not motivated by numbers. If they were, they just want to take pills. They're not. The only reason to sell lifestyle changes because you feel better.
Yeah.
And it makes you healthier, and you've got more spring in your step, and you can do more, and you do it for not because your doctor wants you to do it. You do it because it's going to get you. So we have this dual purpose. So coaches are helping people really land their, why does this matter to me? That's separate from the numbers. Yeah, I want my numbers to get better, but I don't jump out of bed in the morning and do things because I want to reduce their blood pressure. Mostly not. You generally don't even want to look at it. You have to, but you don't want to. You don't want to get on the scale.
Yeah.
He does. So, and you have to have other reasons. And that's why the grounding in the well-being and lifestyle, getting the coaches to really help people find the inner fire for it, the desire, and then build the competence. That's the difference between them engaging or not. And that's healthcare then. That is healthcare. And we've been saying coaching is healthcare. Yes, it's the avenue for lifestyle medicine and well-being, but the process of coaching is healthcare. And that means it needs to be on the healthcare team and part of the system. And that's why it's so important to have coaching codes. And that's really what we've been, and not everybody's agreed with us. Well, no, coaching's part of this and that. It's already being done by psychologists. It's already being done by dietitians. And so that's been our, from the beginning, we've been training coaches to coach so that people actually get things. They get point B. They get the health and the well-being outcomes they want. And so that's why, for those reasons, it's very important that coaching is healthcare. It's not outside of healthcare. Yes, it is outside of healthcare and corporate wellness and other things. But when it comes to being part of the healthcare team, it's very important that we're part of the team.
When it comes to chronic disease management in particular, and I think you've just articulated for me, so I'm so excited, the mismatch between before I hit record, we were talking about how I'm writing an article about how there's this mismatch between what consumers expect prevention to look like and want, and what the healthcare system delivers on that front. Right. And what you just articulated between what a coach, the two roles of a coach, one is helping manage numbers, but the other is to help the patient determine what's in it for them. My numbers aside, what's in it for me? What do I want from this? And the coach bridges those two so nicely.
And the thing is, they go together because everything you do to improve your numbers, outside of taking pills, is going to make you feel better and improve your well-being. You exercise, your mental well-being goes up. You feel more grateful, you're more motivated to exercise. I mean, your well-being is what we want,
Mhm.
and health numbers is what the system wants.
Correct.
But the plan to get there does both.
Yes.
And then when people see, and actually, once people see they can move their numbers, they get excited because if you've just watched your numbers get worse for decades and you've never felt any agency or control over it, you feel hopeless.
Mhm.
Now you do a few things. I remember a client I had who moved his fasting glucose into the normal range after 3 months of our coaching program. And he called me early one morning. I was in California, actually, and he was in the East Coast. And he said, Mark, I looked at my fasting glucose this morning and it was in the normal range. And he was so excited. So he didn't, I don't know that he thought he could,
Mhm.
but when he could, then it became a real motivator. But till then, what the major reasons were more him feeling better
Yeah.
and losing weight, feeling lighter, and all of those things. So, yeah, so I think this is the same synergistic set of behaviors that deliver both, and helping people come up with that is what really is the magic, because nobody knows what combination of 3 to 5 habits is going to get you what you want and what health numbers you need. You don't know. We don't know. Well, it's all the evidence is bell curves, and maybe you fit in the middle of the bell curve. I mean, who knows where you are in the bell curve? But what are the 4 or 5 things that are going to get your diabetes under control, your blood pressure? We
Yes.
don't know. You don't know. You have to actually experiment. And when you find that synergy and it's working for you, you feel like, wow, you just climbed a mountain and you got to the top of the mountain, and now
You feel empowered.
now you've got, yeah, exactly.
Empowered. That's what wellness is really about. That's what I've written about. It's another article defining the field of wellness law. That's how I defined wellness in contrast to health care, conventional medicine. Is wellness is about empowering individuals to find their optimal well-being. Now, however they define it, it's very personal and tailored. Healthcare, conventional medicine is about fixing a problem. And I just love how you've just so beautifully articulated how the coach kind of fits and is the bridge between those two concepts. And I just so pleased that we had this conversation, because for me, a lot of things just clicked into place. Do you have any advice for health coaches who are maybe looking to take advantage of this possible relationship with physicians and clinics? How do you ever guide coaches on how they can maybe become part of that care team that
Yeah.
you're describing?
Well, coaches, we've got 3,000 certified coaches, and half of those are national dual certified. Probably they all will become dual certified eventually, because once the profession gets even more established. So we have a lot of coaches already in healthcare, and what I see is what you want to do is build relationships, trusted relationships with other folks that refer to you. There are
Mm.
quite a few coaches who are working outside the healthcare team doing very nicely, even given what I said with self-pay.
Mhm.
But that does work. And so if you want to help that population, then you need to build trust with a provider group. And I've seen that happen many times, where the doctors just love what the coaches do. The patients are happy. They're really amazed, because most physicians, I have reached the conclusion that people can't change. In fact, the system, payers, everybody has decided people can't change. And because they haven't, they've gotten worse. It's very small number, very few people have signed up for DNOR. It's just beautiful, intensive program. There's plenty of options out there, but the general sense is nobody can change. And that's not true. Not everybody's ready at any given moment. And there's some people have challenges, to be sure. But when you work with you work with patients and the physician starts to they see it in front of their eyes, then you begin to that. So I've seen that happen a lot. The main thing is that you need to be really great at it.
Mm-hmm.
This is a skill. You're not going to get away with being a mediocre coach in the world that we live in today because AI is nipping at our heels. We're going to be competing for limited resources. Even in the last month, I've had comments like, "You can't scale coaches. People can't change." The number of reasons why people don't think that we could have a workforce of coaches is really astounding because we did scale nurses and we did scale doctors and we will scale coaches. But the real deal today is that you have to focus on delivering high impact. That's what we do at Well Coaches. Make sure you come out of your credentials and you keep improving your skills because if what you do works, it will be noticed and it will spread. And that's what's going to make us work. We don't have any room for folks only who are just talking and not moving the needle. That's not going to happen. That's not going to be success. That's not going to lead to success for us. Like anything in life, be really good at it and don't settle for anything less than high impact.
And people can get trained on improving their skills through Well Coaches.
Yeah, and there's other great programs. I think there is a challenge, you probably see it, is that there are a lot of coach training programs that put more emphasis on the expertise, different kinds of medicine. And I'm not being critical of them as a whole, but the downside is if you go into coaching thinking I'm an expert in nutrition or some kind of medicine, that actually is not what leads to effective coaching because now you're giving advice and that's not, unless you are already qualified to do that, you're already out of scope. You're far better to produce really great results in coaching conversations that leads people to do things they never would have done otherwise. And that's because you got them to dig deeper than they normally do. And you got them to see things differently. You got them to feel like it's possible. This is a game of transformation, not just implementing a recipe.
Yeah.
And there's plenty of people that can give you a recipe. There's lots of great recipes out there for improving health, but that's not what we do. We're not recommending supplements. We might help people implement other prescriptions. So you want to be very effective at delivering highly potent coaching conversation that leads to generative change and high energy at the end of it. That's what you need to aim for. And then people will notice you.
That's incredibly valuable advice. It makes me think of this whole transition from well-being to human being. And you're describing a coach relationship as really leaning into that human being aspect that cannot be replaced by artificial intelligence or just spouting out information. It's more than that. It's an intangible that sounds
We're conscious. And our job as coaches, one thing we don't name enough, and having just written a book on the science of leadership, I've been thinking a lot more about this because I was trained as an MBA and I love strategy. And I never really, and that's why I'm doing what I'm doing. I love strategy. I love trying to figure out how to get from point A to B in a very complex situation. And I love coaching for that reason because people don't know. They don't have a strategy for getting from here to where they want to go. And we don't really name our real skill at strategy because we're not bringing a strategy, but we're definitely evolving a strategy quickly in helping people find the path. It's not just falling on the next step. It's actually really understanding what combination of things. So I think that strategy requires human consciousness and analytical abilities. And AI is amazing. I love Claude. I love it. I have a great time. But it's not going to replace a coach. It has a different purpose. It has a very different purpose. And it's going to help people coach themselves. But it's not going to replace the human ability for me to see your potential, to intuit it without a lot of data.
Yeah.
Know which way to take the questions and reflections. So you come away with, oh, I never thought about that before. That's consciousness. Seeing the potential in the moment, it's conscious. It's not just neural networks by themselves.
Yeah.
The conscious side to this, that is, consciousness leads to resonance. You resonate with me right now. We feel like we're in the same moment. We feel like that we're going somewhere in this conversation. We're awake. We're alive. That's being alive, and that AI can't do that for us.
Yeah.
And AI can't create the conscious experience, because in a way we're raising consciousness in coaching. We're waking people up. And it takes one conscious person to help another conscious person. And that will never go away.
No, I think we crave it as human beings. We crave it.
We want to be awake, want to feel life, we want to feel alive.
And I think coaching can definitely keep that alive. And I'm hopeful. So this conversation has been so informative and enlightening. And I just so grateful to you for your work and for your time today. Now, if people want to learn more about Well Coaches or you, how can they do that?
I'm active on LinkedIn, so that's the best place. In fact, I just shared a submission we made to CMMI, that's the innovation department of CMS, because when we met, they asked us to put together a framework for patients to have goals, which we did, and it's on there. So LinkedIn/Coach Meg is
Okay.
the best place, and then it's Margaret@wellcoaches.com for email.
And wellcoaches.com is the website for they want to learn.
For the school.
Okay. Okay. Thank you so much, Coach Meg, for everything. I'm just so grateful.
Thank you, Barbara. Thank you for having an interest and following this and contributing to it. People always say, what are your predictions of the future? Where do you think we're going? And I always say we're shaping it.
Good response.
If you're not shaping your future, it's going to be shaped for you. So we all need to shape it. That's our job as coaches. We're not bystanders. We're actively shaping the future.
I think it's true for everybody. Be active at shaping your own future. And coaches can help you get there. All right.
We're professional shapers.
Thank you again.
Good. Thank you, Barbara. Wish us luck on all this, and we'll keep you posted.
Yes, please do. Good luck.
Sure.
Thank you for listening to the Wellness Law Podcast. You can find more wellness law resources by visiting the Center for Health and Wellness Law website at www.wellnesslaw.com, where you can also subscribe to our newsletter and follow us on social media. Until the next episode, stay well, stay hopeful, and stay legal.